We also check the estrogen and the progesterone because those are two hormones that we can supplement back to the patient to help make sure that everything is appropriate and to make sure their levels are appropriate to give them the best chances of success. From there, the patient's monitored after making sure their beta-HCG is rising appropriately with an ultrasound around 5 to 6 weeks to confirm that the pregnancy is in the uterus. Right? Every so often, IVF pregnancies can occur in the fallopian tube. That's called an ectopic pregnancy, and that's a life-threatening emergency, so we want to make sure that the pregnancy is in the uterus. And then the patient is monitored at regular intervals to make sure it's a normally developing pregnancy.
Here at CCRM, if you are positive, you are 4 weeks pregnant, depending on exactly what day we do your initial blood work. Our protocol then is to repeat the test 2 days later, and if all looks good, we repeat it again around 5 weeks. So at this point, we're looking at your beta-HCG levels to make sure that they're rising about 66% every other day. That starts to decrease around 5 weeks, so we're not looking at that as much. We want to make sure that the support you're on, the estrogen and the progesterone support, are adequate for the pregnancy. So we're also looking at those levels. After your initial ultrasound at 6 weeks, we usually tell you to come back again around 7 weeks if all looks good. At 7 weeks, I always say, make sure your partner's here, because we are looking for a heartbeat at that time. So if there is a nice strong heartbeat at 7 weeks, we'll bring you back again at 8 weeks. And then we're talking about discharge. So discharge is a great word because that means we're also weaning you off your medications at that point as well. Once you're completely weaned off your medications, you're following up with your OBGYN, usually around 9 to 10 weeks of pregnancy, depending on their specific practice.
Quite often patients say to me, I did IVF, that means I'm high risk, right? And the answer is no. Humans are designed to carry one pregnancy at a time to term. So there's no reason to think that just because you need a little help getting a kickstart, that everything's going to go bad from there. So we frequently tell patients no, you're normal. It's okay to be pregnant, and you're pregnant just like everybody else. And there's no scarlet eye that you have to wear on your shirt when you get to the hospital for everyone to know that this is an IVF pregnancy. The last thing to know is that according to the American Institute of Ultrasound Medicine, or AIUM, every IVF pregnancy in America should be monitored with a fetal echocardiogram or a special ultrasound done around the 20th week or mid-gestation of that pregnancy, just to make sure there's no cardiac side effects that are there. But other than that, once you're pregnant with IVF, you're like everybody else, because eventually we pull away the hormones and you're off on your own.
Whether your result is negative or positive,